Man and woman were fed up with heavy sweating, so they had elective surgery to stop it. What they didn't know is that it would spark life-altering side effects. Now, hundreds of people in a support group say they'd rather be dead than alive after the procedure. The holidays used to be Alexander Parker's favorite time of year. Not anymore. It's just a feeling of being dead. It's not even a depression. I don't feel upset that the holidays are here. I just can't get into it. Alexander feels emotionless. She can't get into anything. She explains it began after undergoing surgery called endoscopic thoracic sympathectomy, or ETS, to stop excessive sweating under her arms. I would go out in 30-degree weather in shorts and a tank top and still sweat. Just absolute buckets. The surgery stopped her underarms from sweating, but now she sweats excessively everywhere else. So it was trading one problem for a worse one. Doctors tell her it damaged a nerve in her chest cavity that now causes massive shoulder, elbow, and hand pain. Chris Umble can relate.
Let's take a look at your hands now and see how they're doing.
He came to Dr. Raul Nath at the Texas Nerve and Paralysis Institute to have his awful symptoms reversed.
A lot of small side effects, and they just take their toll on you after time.
Chris just wanted to put an end to clammy palms, but after ETS surgery, his entire body started sweating so severely, even on cold days he had to change his dripping clothes. It also affected his emotions.
Well, you don't feel that joy that you used to, or the other way around, you don't feel the sadness.
He now suffers arm pain, tingling in his head and back, and brain fogginess. But Dr. Nath has helped at least some of those symptoms.
He took a donor nerve out of my ankle, sole nerve, and bridged the gap on the sympathetic chain.
Sympathetic nerves that are typically cut are right here at the upper chest. Sympathetic nerves run up and down the whole spine. They're responsible for release of adrenaline, a blood vessel opening and closing response to temperature changes.
Dr. Nath believes when the nerve is cut, it could interfere with adrenaline, which could spark those emotional problems.
Dramatic change in their life.
Dr. Mahesh Ramchandani has teamed up with Dr. Nath to help reverse the procedure, but he still believes ETS is a great option for the right patient.
This procedure is a very, very useful procedure. It has transformed many lives.
But he admits at least 30% of patients will have negative side effects. Side effects that both Chris and Alexander say they'd do anything to end. While a reversal can slightly help, they can never be completely cured. To find out more about Alexander's support group and what others have to say about ETS, go to the Help tab of our website.